Talk Erie and the Joel Natale Show. We're live from our Kingdom Financial Group studio here at 5th and State. Also live on YouTube and on Facebook. It's our monthly conversation with our friends from Hilling-Pfeffer Insurance. And I'm glad to welcome back Emily and welcome in Morgan. How are you?
Good. How are you?
Doing well. You want to give a little shout out of your origin story? Are you from around here or did you transplant in?
So I am from like the McCain, Edinburgh area.
Nice.
And then
Did you go to GM?
Yep.
Okay.
Yep. Graduated from General McLean.
We're all distinguished by what high school we go
Yep.
to, right?
Did you ask me mine?
Well, I'm probably at some point.
I'm curious as to what mine means.
Where'd you go?
Northeast.
Okay, yes. You're a picker.
Gotta love David Letterman for that one.
Oh, did he make a remark?
Northeast made the top 10 worst school mascots on
The
the
great
David Letterman
pickers.
for being a great picker.
Oh, I love it. That's awesome.
Oh yeah, back
I
in the
didn't even know that was
early
their mascot.
2000s.
That's so funny.
Oh yeah.
Yeah,
It's a machine technically.
the Lancers, it's
Yeah.
A little bit
more
better.
noble, I mean, hey, we love Northeast. Don't get me wrong. I can get myself in
Sorry,
trouble.
off topic.
30 seconds into it, I'm getting into trouble. All right. Well, welcome, Morgan. I'm so glad that you're here. And Emily, welcome back. You made an excellent point. We're entering into the third quarter.
We are.
And fourth quarter is when open enrollment hits, isn't it?
Multiple open enrollments, yes. So we have Medicare as well as Penny open enrollments that will be starting October 15th.
Wow.
Yes.
Incredible. So, all right. So what is your advice to as people start getting ready for this now?
Well, depending on how far you like to plan ahead, we can set your appointment now after October 15th. That way we have it set that we are going to review your plan on this date and time, whether you are Medicare or Penny. We cannot really discuss things before, but
Okay.
much like your doctor's appointments, you don't want to discuss it before. You wait to the appointment and bring everything up. So depending on how far you like to schedule out, we can start scheduling that now. But definitely at least kind of start thinking about how your plans worked for you for the year. Did you like it? Did you not like it? Was there anything unexpected that happened? Has your health changed in the past year? Any new prescriptions? All things to start thinking about, not necessarily having to write down and really track, but just to kind of question is a great place to start. Yeah.
Keep it on the radar. I gotta ask you. I know this is gonna be probably such a rookie question, but there's this difference between Part B and Medicare Advantage. Can you explain that again?
Absolutely. So Part A and B, you do with the federal government.
Okay.
I cannot necessarily help you with that. I can guide you and say, we got to sign you up here. Needs to be this date based on what you're telling me. But the federal government takes care of that.
So
with
A
you.
and B are the government. So I didn't even get that part
That's
right.
okay.
So then what is Medicare Advantage and what is it, Part C?
You're catching on, yes.
Okay.
Yes.
All right.
So next.
Is that one and the same or they're different?
Nope, that is one and the same. Your next question for yourself is, does an Advantage plan or Part C or a supplement and Medigap fit you?
That's the difference.
Correct. So Advantage or supplement is the next question. And then that choice dictates potentially another question for you. If you go the Medigap or supplement route, you then need Part D as well, your prescription coverage. D equals drugs.
Versus Advantage generally has the drugs?
Correct.
Or no?
It's included with it.
Okay. And why would some people not take the bundle in the Advantage plan versus,
It can be a couple different reasons. I love the example of I have two clients. They are sisters, very close sisters, and they will love that I'm talking about them.
Yeah.
But they couldn't be more different when it comes to their health insurance. The government is not getting any more money than they can get out of me, and likes the employer plan, it's less out of her pocket monthly. It would be more expensive if she needs to use it, and the more she uses it. However, the other sister is the cautionary tale, let's say. She's the better safe than sorry. I don't want any more money coming out. I want to know what I'm spending. So she has a higher monthly premium, but there's less out of her pocket if she uses it. Okay. So supplements, if you have more of a consideration if you travel a lot, because supplements, there are no networks. So I like to make the joke, if you've got kids in Colorado, Texas, and Florida, a supplement would probably fit you if you're going to be that grandparent that travels to them all.
Interesting.
Or if you maybe have a tricky family history with some things that you're very concerned with, or maybe you currently have things going on that you're going to have quite a few doctor's appointments just for the rest of your life.
So supplements will cover that more often than the Advantage plan?
Correct.
Is what you're saying?
They cover it less out of your pocket when
Okay.
going to see the doctor, but it's more out of your pocket monthly for the premium.
Yeah, and then there's this whole other thing. And again, I'm sorry if I'm getting us on a rabbit trail.
These are very good questions.
There's the whole other thing of how much else do I want my Medicare add-ons, if you will, to cover? Even like food, right?
Mm-hmm. So you're specifically mentioning probably healthy foods or over-the-counter cards. Those are on Advantage plans. While those are important to consider because they can make a difference for folks, they are not the be-all and end-all for your insurance.
Okay.
So we love those. We call them the enticers. But if you are someone who does have things going on medically and are going to use it, we can't count on those over the counter. We want to look at what the benefits actually are. If you're going to go to the ER or if you have to see your primary care regularly.
You know, something we haven't talked about is what about like preventative health, like, you know, a gym membership or what is it, silver sneakers or stuff like. Can you talk about how that plays into all of this?
Absolutely. As with all health insurance, they would love you to be healthy and be the healthiest person you can be because it's going to end up being less out of their pocket in the end. So another kind of enticer, Aetna is specifically silver sneakers, but generally they all kind of have a version of it, and that is on Advantage plans as well. It can be on a supplement if you add it, but generally those are Advantage plans. And it is silver sneakers, so you can go get a gym membership or sometimes gym equipment or a pair of sneakers depending upon the plan and the benefits with them. That is one of those things that can change year to year.
Okay.
Gym membership will never go away, but depending on if you didn't want to use it specifically for that, that could change.
Okay. Let's get back on track here. All right, we're talking about open enrollment. What if someone, you know, has been happy with their plan? Should they review it every year?
Absolutely. Better safe than sorry. Let's take a look at what the changes are. Most likely there is a change or two in your plan.
Okay.
Aetna, lovely, last year changed all their names. And that was so much fun. And just kind of explaining that difference and making sure, folks, you will receive a new card because it is a new name. So your benefits may not change that much, but that's something to watch out for. Or benefits can drastically change and you no longer like that plan. They do send you your plan benefits, but it's always easiest when somebody else can kind of spell it out for you and pull them up side by side and make that comparison.
Morgan, weigh in on this. Do you get a sense that that with change, the clients get kind of a little exasperated?
Definitely. Yes. Nobody, I mean, I'm a creature of habit, so I don't like change either.
Yeah.
But I mean, especially when it comes to your healthcare, you don't want any surprises popping up, and it's better to just be aware and stay on top of it.
For sure. So you do work a lot with folks turning 65. Let's talk about the typical questions. What are the FAQs, if you will?
Probably, when do I need to sign up for Medicare and do I have to? And that's probably the biggest question. Is just
they literally will give you not a fine, like a fine or something if you don't.
There can be, yes, there can be
Yeah.
penalties if you don't pick up prescription coverage or if you don't pick up Medicare or you go without health insurance. Those are very unique situations. Hopefully that doesn't come across to anybody.
Yeah. It's just one of those things that is a rite of passage at 65.
Correct.
You got to sign up at least to say, hey, I'm not going to take it right now.
Yeah.
Correct. You absolutely can delay it if you
Yeah.
are still working and you have employer coverage. You like that. But it's also absolutely right if you're still working and you don't like that employer coverage and want to get on Medicare, you can. Whatever fits you. Talk to somebody.
Yeah.
Talk to someone local like me. Much like your life did, if she doesn't mind me saying that, just to know when. I've got these things going on. I'm planning on retiring there, but I've got a husband doing this, or I've got a spouse doing this. What are we kind of guiding it through? It's very unique each time for each person.
that 3 months before turning 65 is a big deal. That's kind of like the launch pad, isn't it?
Yes. The government really would love you. It's kind of like they're trying to get your attention almost in that first
Interesting.
3 months. Like, please do it. Please do it. I like to say start then because we are working with the federal government and there are hiccups. So as long as we know there are going to be hiccups, I feel like it's slightly smooth. And then when that bump happens, you can keep driving and it doesn't veer you.
We're talking to Emily and Morgan from Hilling-Pfeffer Insurance about Medicare. Let's actually pivot right now and go talk about Penny. This is the Pennsylvania marketplace, Obamacare, if you will. What exactly are we talking about when it comes to Penny?
Penny is, as you said, the individual marketplace. So if folks are not offered health insurance through their employer or are not working, whatever the reason, this is where they can come pick up insurance. It is income driven. So we do need to know your household income and put in a few different answers for the government to figure out what you qualify for and then pricing for things.
Okay, let me stop
Sorry,
you there.
getting ahead.
No, that's good, because what if I'm like, a go-go contractor, self-employed, and
Very
I'm
good
making
question.
6 figures here? Can I get Penny?
Yes. You just may not receive any help from the government with it, the annual tax credits.
Okay.
That was a big, probably scarring some people with saying those words. Annual tax credits, while they did change, they did not completely go away. So if you were a go-getter and that contractor making quite a bit of money in a year, you probably won't receive any help from Penny, but you'll just pay full price for plans like you would anywhere else. Or if it's a single parent family, working part-time, because whatever the situation drives, they'll receive more help from the government with that, especially with having kids on it.
Okay, and does Penny work, if you are low income, does Penny work with CHIP?
Yes. So Penny would then kind of send your application to CHIP and say, your kids look like they may qualify for Medicaid or CHIP. Please go do that application. So they're trying to kind of centralize and make it all work cohesively together.
Yeah,
but
we
it is
should probably
technology.
tell folks CHIP is the Children's Health Insurance Program for low income children up to what, 18, 17?
Yeah, I believe so, yes.
18, yeah. So there's that element. What about the enrollment period for Penny? Talk through that.
Penny is October 15th to December 15th.
All right, 2 months.
There
Wow.
is a big change this year. So we used to go to January 15th, and January 15th would be a 2-1 effective. That is no longer. You only have those 2 months, October 15th to December 15th, for a 1-1 effective this year. There is no catch with that 2-1. And I'm slightly worried that that's going to affect some folks because the last minute Nellies always could count on that, but we cannot.
So it used to be that you could backdate it to 1-1. Is that what you're saying? Or?
No. So if you miss the 1-1 enrollment because you have to put your application in by December 15th.
Yeah.
If you missed that, so you submitted it December 18th for whatever
Sure.
reason, or in January 13th, let's say.
Okay.
As long as it was before January 15th, you could be 2-1 effective.
Oh,
So it was just a slight delay.
got it. And now it's not?
No, now it is only 1-1.
Yeah, there's no more catch-all for the people who waited or
Or missed it.
That sounds like that's going to be an issue.
That's why we're here, trying to put it out there now.
Yeah.
Penny is doing a decent job of putting it out there as well, but it's one of those things to be aware of.
But see, they can't jump on it now. They have to wait till the 15th of October.
Yes.
Much like Medicare, if you are someone who wants to plan ahead and set your appointment with us,
Okay.
we will happily put you in the calendar. But no, we technically don't know what 2027 will look like just yet.
What about understanding whether or not you're eligible for financial help? I would imagine there's a lot of confusion that way.
There is. I like to say, let's put it into Penny and see what it says.
It's kind of like everybody needs to fill out financial aid for college, no matter what. Don't assume that you're not eligible for aid.
Yes.
Correct. Yes, you don't know. Even I could not tell you technically hard what those income levels are. Let's let Penny do it. And a contractor, you brought up that example, that probably depends month to month. So we're working in 2026 for 27, but we'd look at 2025 taxes. And then,
Okay.
if you have an extremely high month, we should probably note that because you have 30 days within Penny to note income changes. So a contractor is a good example of that, or a server.
Oh.
Because month to month that can drastically change, and it also depends on what you're claiming, different things like that.
If you're down at the Bayfront, your big months are June, July, August, right?
Exactly.
You know?
And so we want to make sure and claim those, make sure it's on the up and up, or at the end of the year, Penny's going to reconcile it with you, and it's going to be a bigger bill potentially.
All right, let's zoom out 30,000 feet. Biggest misunderstanding about health insurance?
I think just what we went over, not thinking you qualify, so not doing it. Or just thinking it's a silly question or something I should know the answer to. There are so many questions I get a day that I'm like, that's a good question that I should be able to answer lickety split for you, but let me research. So I love when folks ask me questions, because then the next time I'm asked, I have the answer because I went and looked it up.
I'm in one of those modes where I used to actually be a health administrator for the company that I ran, and a company I work for as well. So I did this for like 28 years. I wouldn't dare to try to step into that now, 8 years out of the process, because it's all changed. Everything has changed.
I was just speaking with our intern at Hilling-Pfeffer today, and he asked me, what is kind of your ratio between doing claims and speaking with your current clients and out prospecting for new clients? And I said, it's about 50-50. New clients are technically the only way to keep money coming in. However, your reputation and referrals are everything.
Yeah.
And so that comes from your current clients. My current clients are always the ones telling me what's going on in Erie as well, like Delta Dental being kicked out. Mostly.
I didn't know that.
It seems like a lot of dentists do not like Delta Dental anymore.
Okay.
It seems like something went on the back end with payment.
Sure.
But things like that, I only hear the scuttlebutt from when people tell me because something happened to them. Or, Emily, this is going on. Did you hear about this? Or listening to your radio is awfully very informing a lot of the times too.
Yeah. Wow.
It's a lot to stay on top of. And in my opinion, expecting any layperson to do that is inconceivable.
Yeah, that makes a lot of sense. All right, got like 2 minutes left with Hilling-Pfeffer. Let's go through some traps and foibles that we might make during enrollment. What do you think?
Waiting to the last minute, or not reviewing prescription coverage, or assuming all doctors remain in network. Networks can change.
So literally every year you should be going through the directory, huh? Well, you never know if your doc is retired. My dermatologist retired last year.
I knew you were going to bring up dermatology. A little bit of a pain point in Erie
right now.
Very much
tough.
so.
Yeah.
Very much so. Yeah.
And dentists, dentists are retiring too. Again, all of your baby boomers or even older, they've had enough.
Yeah. That's something that we sit down and we offer our clients. Let's see who's in network, and I will check with them on site, because I'd rather you not call me in the middle of the year and be mad at me.
Yeah. I ended up, I don't even know what I'm going to do about my dermatologist, because I don't think there's anybody in my network.
So you have to go to, you said you were on Aetna, if you don't mind me asking or saying. So Aetna, if you go on their website, you should be able to plug in what plan you have specifically, and any carrier can do this with. You should plug in what plan you have specifically, and then you should be able to search dermatologists. Yeah. There has to be somebody somewhere.
Yeah. So generally, they might want you to travel 50, 60 miles.
Yes.
I think I just looked up somebody in Meadville. It was not Meadville Medical Center that they were out of, but it was a dermatologist.
Interesting.
We were trying to find a network.
Isn't that something? Wow. Yeah. All righty. Let's tell folks how they can get a hold of you, because you guys have recently moved a little bit?
A little bit.
Okay, go ahead.
So you can always reach us at our main office at 332 Holland Street, just around the corner from you. And that phone number is 814-870-3109. Or if you want us health gals specifically, we are moving up to Richmond Street by the end of next week. So it's behind Contemporary Motor Cars in
up in there,
station. Or our phone number is 814-455-7611.
Again, always a wealth of information. Appreciate it. Emily, welcome, Morgan.
It's always a pleasure.
So glad to have questions answered, and we appreciate the partnership with Hilling-Pfeffer Insurance. Thank you so much.
Thank you so very much.
Thank you.
You got it. All right, it is 3:54. It's Talk Erie.